The FDA is expected to make a final decision on the Alzheimer's treatment Leqembi today. The drug is made by the Japanese pharma company Eisai and Biogen. And if approved, it'll be the second drug in the U.S. to treat Alzheimer's. The expected price, $26,000, $500 a year. Joining us now is Kavita Patel, NBC News medical contributor, former Obama White House policy director. It's so hard to name drugs, Kavita, that there's a Q, but no U. So that it's come to that, Leqembi. So we're running out of names. But 26.5, we should hear today whether the CMS is going to cover this. And it looks like it was a unanimous FDA panel. So it looks like it gets approved. And there's some body language that the CMS is going to say, OK, we'll cover it.
Yeah, CMS has earlier already indicated that they would put together kind of a coverage program, what we would call coverage with evidence development, essentially asking neurologists and treating physicians to put data elements into a registry to make sure that we're sharing information. By the way, we saw this same sort of requirement with TAVR, the cardiac procedure. So I think that CMS is trying to send a signal that, yes, indeed, if the FDA gives it full approval, reminder, Leqembi is under accelerated approval right now, but with no CMS coverage. So this full CMS coverage with conditions is signaling that they will indeed approve this, cover it, both CMS and the FDA, but the devil's in the details, Joe, because not everybody can get access to it, even with full coverage. It's not a very easy drug to give.
Eventually, though, as in Eli Lilly, it looks like maybe the amyloid protein is important, not just the result of, but perhaps involved in causing Alzheimer's. So we're going to get drugs for this, which, eventually we're going to have to face what this means for our healthcare system and how much things cost. And I don't know how you think we should approach that, because other medicines are helping us live longer in a big way, quantum leaps. Along with that comes some type of dementia, it seems like, the longer you live. So you're going to have more people at 26.5 a year. So we're going to break the bank, Kavita.
Yeah. Look, listen, this is, and especially because the goal of this drug is to really try to catch people in the early phases, what we would call mild cognitive impairment, might not even have a technical diagnosis of Alzheimer's at the time. And Joe, if you look at the aging population, just as you said, that can get into, right now, it's about 6 million that we think have Alzheimer's dementia. That can grow even in a decade or so to double digits. And then when you think about people that are right before Alzheimer's, even a larger population, as high as 10 to 20% of the population. So to your point, yes, this is expensive. That 26.5 doesn't even get into the costs of the other services that are required. This is a drug that's administered by IV under monitored infusion. You have to be monitored for at least 30 minutes to 2 hours after that, once every 2 weeks for at least 18 months. So it's not a trivial undertaking. And then the nursing staff, the physician staff, infusion chairs, even at just large hospitals, which don't exist in many rural areas, which means we're going to have an access problem for a majority of America that can't get to one of these treatment centers. Not to mention that if you've tried to make an appointment with a neurologist, not very easy to get in. So we're going to have to retrain our system to take on this problem, along with many of the issues of an aging population. It's very similar to what Japan is facing as well. And they're trying to get creative about access solutions, including to drugs like Leqembi, which we expect approval after FDA approval. So it'll be interesting to watch Japan do this as well.
We need a pill. And the offset is that the long-term care for someone suffering from Alzheimer's is really expensive too. So I mean, that eventually you could hit a point where it flips. But what you described in terms of the infusion and everything else makes it seem like it's very difficult to administer. But we're at the early stages, and let's not be too negative. It's good to be making some progress, I think, Doctor.
It's a huge it reminds me of the late 90s with cancer treatments with monoclonal antibodies. This is pretty groundbreaking.
Yeah, when the first monoclonal.
Big deal.
And now look at it. Exactly.